Hi, Dan McFarland, your physical therapy assistant and creator of Mobility Max 10-minute home exercise system, here with tips, strategies, and conversation about how to keep moving, how to look your best and feel your best, even as you pass 50, 60, 70, and beyond. So today what I want to discuss is spinal range of motion. Okay, but before we go any further, please share, like, follow, and subscribe. Any of those, all of those are greatly appreciated. So in a previous video, I talked about one of the essential ingredients in the Mobility Max 10-minute home exercise system is going through and preserving range of motion in all of our major joints. It's one of the most simplest and important things we can do for our musculoskeletal system. We all have one of these. The musculoskeletal system makes up about 50% of your body. If you learn just a few tricks and take a little time to take care of it, it's going to pay enormous dividends for you. So maintaining range of motion is all about the action at our major joints. That would be our shoulders, our hips, our knees, the pelvis, the spine, primarily. So, you know, it's a fairly short list. Even though there are a couple hundred movable joints, we don't need to worry about all that. So, the spine is a peculiar joint in that it's a series of joints, vertebrae, separated by discs that make up our spine. Now, what is our spine supposed to do? Or what is its potential? Well, it allows us to bend forward. That's called flexion. It allows us to bend backwards. That's called extension. It allows us to bend to the side. And it allows us to rotate. All of that action, that vital action, depends on the spine. So what do you think will happen if you allow the range of motion in your spine to diminish? We all have a normal, natural range of motion that we were given. Now we've lost some of it, but that's okay. We want to preserve what we have. We don't want to continue to lose range of motion in our spine. So now I'm going to show you some of the exercises in the Mobility Max 10-minute home exercise routine that consists of 20 therapeutic and functional exercises meant to be performed each day with the Mobility Max exercise bar. I'm going to show you some of the exercises that are more or less focused on mobility of the spine. So here's the first one. I call it the bow. So I take my exercise bar, I insert it at level number 3, and I get back in this position, and I bow down, and I stretch. And I generally hold each one of these for 30 seconds. So that was just a short version of it. But it decompresses the spine, stretches all around the upper part of the back, and relieves tension in the lower part of the back. I'm going to move this back just a little bit. Okay. So the next one is one you've seen, I'm sure, in yoga and other practices. I call it the dog and the cat. It looks like this. So what I'm going to do is I'm going to oscillate the spine through flexion and extension, but then I'm also going to bend to both sides. So lateral bending. Here's how that works. gosh, every time I do that, it feels so good. Normally, I do each exercise for 30 seconds, and that's what I recommend is 30 seconds for each exercise. But it just feels so good. That's why I call these are therapeutic exercises. Hey, why not do our therapy for preventative reasons and to maintain ourselves rather than wait until we have pain, we have dysfunction, and now we have injury and perhaps surgery, who knows what, pain medications, and then we're trying to do our therapy. Let's do our therapeutic exercises now. So next is a spinal focused exercise called the bridge. Excellent for low back health. So I take the bar out of position number 1 and I put it up to position number 4. And this is what it looks like. And it really tightens these glute muscles, which are big shock absorbers for the low back. And then you just oscillate. Not sure how that's going to look, but hey, that's what it is. Next, okay, so we've covered extension. That was extension, by the way, bending back. Extension is really, really important. We're always flexing over, but what we need to do is go into extension occasionally during the day just to maintain that range of motion. So that's what this next one does. We're going to do some extension and we're going to do some rotation. I'm going to bring the bar up just a little bit. Position number 5. And the first thing I'm going to do is, yes, use the bar to help me get into extension. Boy, this is a powerful exercise. I can really feel the stretch through here, which is really important. And I've got the bar that I'm kind of pushing down on. And as I push down on it, my chest lifts and my shoulders go back. Wow, it feels incredible in the low back. Now the rotation part comes by putting one hand on the outside of the bar and pulling around, turning. So I'm using the bar as leverage to turn my spine from my head all the way down to my waist. Turn it as far as I can. Okay, so I think that's about it. Spinal range of motion. Practice it, learn it. It's simple and it's so healthy. Why are we not doing these things? Well, that's another whole video why we're not doing these things. But anyways, please share. If you watch this to the end, please share and let's get the word out about how people who are 50, 60, almost 70 and beyond can stay in shape and have a great quality of life, be independent and have fun in just 10 minutes a day with Mobility Max 10-minute home exercise system. Thank you. See you next time.